Hi, my name's Greg Fallon. It's my pleasure to introduce my first Director of Public Health Annual Report. I've been in Sheffield for about 6 months now, and each year Director of Public Health has to produce a report, which is a public report, which sets out how healthy Sheffield is, or not, as the case may be, what the key challenges are, and what the key issues are for the future. People like me are often given grief for, well, health hasn't improved that much since last year, since you wrote all of these things last year, and there's some fair comment in that, to be honest. My pitch this year and the key message this year are three or fourfold. One, there are some great success stories. We're living longer. Life expectancy continues to increase, and that's a great thing. We're living longer, and life expectancy on average is just short of 80 for men and just over 80 for women. That's a good thing. There are some problems, and the two obvious problems are, one, there remain health inequalities. So if you look at the life expectancy between the best and the worst, there's a 20-year difference, and that's not acceptable. And it's not just a geography thing. It's not just a Dor versus Darnall thing. It's also a population thing. So if you look at life expectancy in those with learning disability or those with severe mental illness, there's a big gap in life expectancy in those two groups and the population average. So again, it's not just geography. So that's the first bit of bad news. The second bit of bad news is, although we're living longer, we don't seem to be becoming healthier. So there's another piece of information which is often used to describe the health of populations, which is known as healthy life expectancy, the point from which you're born to the point at which you start getting poorly. Sadly, that's not improving at all, actually, in Sheffield or in England. So that's the key challenge as far as I can see. So a healthy life expectancy isn't improving, and that's an obvious challenge. Healthy life expectancy is just shy of 60 for men and just over 60 for women, and again shows the same pattern of inequality as does life expectancy. So the gap between best and worst is 25 years. And again, you ask, is that acceptable? My view, no, it's not acceptable. It's not very easy to change, but it's definitely not acceptable, and it's the key challenge. I see it as my key challenge. The third challenge is that this is a Director of Public Health Annual Report. Public health, or the health of the population, isn't what I do or what my team does. How healthy we are or not is basically the sum total of all of the stuff that goes on in the city, not just and far from health care. It's the sum total of all of the social policy activity that goes on in the city, the sum total of what the council does, what the private sector does, what the NHS does, what the voluntary sector does. That determines how healthy we are or not, and that's the thing that matters. So, and I'm kind of slightly repitching the way that we look at health in this report this year. Historically, public health has been perceived to be concerned with, well, we must prevent the preventable because it saves on health and social care costs down the line. Well, yes, it probably does, and it's probably one of the principal ways, one of the principal solutions for the current problems in the health and social care system is to prevent more than we do at the moment. But it's not just that, and certainly one of the big thrusts that I've put into the report very clearly and squarely is that a healthy population is an infrastructure investment for a vibrant economy. So if we've got a whole load of people who are off work because they're too poorly to work in one way, shape or form, or because something's happened, they may have had a heart attack, or they may have severe depression or something else, that's bad for them. Bad for their families, bad for their health, it's also bad for the economy. So I'm deliberately trying to shape the way that we think about health in that way. So, obvious challenges. The population is growing. That's a good thing. The population's growing slightly slower than we thought it would grow, but population growth isn't uniform across all ages. So the population that's growing really quickly is the elderly population, and I'll come back onto that in a minute. And the young population is also growing quite quickly. And there's a quirk in Sheffield in that we have a very, very high proportion of 20 to 25-year-olds. the obvious explanation for that is the student population that finish their degree and then stay in Sheffield. That's a good thing, that's a key asset of Sheffield. The population is becoming more diverse. That's a good thing, a really good thing, because it brings a whole range of cultural influences into the city that we may not otherwise have, and it's a great thing that will continue to happen. I'll come back to the ageing population. Yes, the population is ageing. And the number of people who are 65 or more, or wherever you want to define the cut-off of ageing, is going up. The next obvious issue is the contention that the ageing population will sink the health and social care system. It's factually not true. What may be problematic for the health and social care system is how poorly we are, not necessarily how old we are. And much of that poorliness, much of that illness is preventable. So we know, broadly speaking, what to do. And so the challenge from the public health report, and my challenge to the whole of the city, as I say, is to prevent the preventable through a range of actions and activities. And with regard to the ageing population and the notion of healthy ageing, start young. Healthy ageing starts from birth, not on your 65th birthday or when you retire. Yes, when you retire is really, really important, and we want to maximise the health and well-being of the older population. But the concept of healthy ageing starts from birth, and that's a really important reframing message. There are some success stories. So looking back over the past 10 years, there have been some spectacular successes. Rates of infant mortality have plummeted, brilliant. Rates of teenage pregnancy have plummeted. That's a really important social and public health problem. That's really good. School readiness is a success story in Sheffield. So what's school readiness got to do with health? Odd combination. We invest in education to educate our children and all those kinds of things. A well-educated population that does well at school tends to get better jobs. Better jobs equates to better health at the end. So it's important that we invest in kids from a very, very early age. As the old saying goes, the first 1,000 days are the most important and the most valuable investments across life. That matters, so we need to continue to get that right. There are some challenges, yeah, of course there are some challenges, but there are some success stories, so clearly we need to celebrate those. Obesity in 0 to 5s. Obesity in 4 to 5s is a success story. The data's going in the right direction. That's really good. Doesn't seem to be going in the same direction in the adult population, however, so there are some challenges there. So the big specifics for me for the next year or so, broadly speaking, fall into a number of areas. Life chances, maximising and optimising life chances. We're going to do some work over the next year to really get to grips with the relationship between work and employment and health. We all know that being in work is a good thing for your health. And being in work that promotes and enables and encourages you to be healthy is a good thing. But also we know there are people who aren't in work because they are too poorly to be in work. So the onus will be on us to find ways of encouraging, helping and supporting that group of people back into work. And that's a big challenge number one, to explore that relationship between work and health and to really get that right. Second big challenge for me is what's commonly known as the concept of social prescribing. So typically when you go and see your GP, often the stock response or the standard response from the GP is a drug, a prescription of a drug, which sometimes medicalises what's a social problem. But that happens because those GPs, and it's not just GPs, it's health and social care professionals across the board, that's their standard response, that's what they've been trained to do, and those are the options that are available to them. So we want to change that, and we want to scale up what's commonly called social prescribing to give, let's continue to use GPs as the example, to give GPs a range of other non-medical options that they can use to help their patients. So using exercise classes is the obvious example, but not just that. Using a range of community and voluntary sector organisations and the services that they provide to give people options that aren't antidepressants or statins or antibiotics. So we will scale that up over the next year and make it a citywide endeavour, and we'll get the model right so that all health and social care professionals have an access to what we call social prescribing. That's challenge number 2. Challenge number 3 is around lifestyles. So I've said in the report there are 900 or so preventable deaths every year for people in Sheffield. A good proportion of those are in working age population. And underneath the death is a whole range of illness and poorliness. So much of that's preventable. Much of the preventable illness and death is attributed to lifestyle, how much we smoke, or whether or not we smoke, how much we drink, how much exercise we do or not. So we'll be looking to launch a whole range of initiatives to encourage us all to smoke less, drink sensibly, eat the right kind of stuff, and move more than we do at the moment. And move more will be an obvious and big challenge for the city over the next year. So I'll obviously be encouraging the city to sweat rather more than it does at the moment. We do quite well, to be fair, but we need to do better. And the last challenge, which is a really tricky one, is I think we've got a pretty good strategy on mental health. It's not perfect, but our focus on mental health is mental illness and services to provide treatment to those who have an illness. The critical challenge is to move that on to it being about mental well-being. And that will be a key challenge. I think firstly we need to understand what mental well-being actually is, and then how can we, and I don't just mean the City Council, I mean the city as a whole, implement a range of initiatives to improve mental well-being.